If your dentist just told you that your gum disease is so advanced that you may lose your teeth, what do you do next? Hi, I'm Dr. Daniel Choi, board-certified periodontist since 2011 here at North Texas Dental Surgery. And today we're tackling a big question. Should you keep fighting for your natural teeth or transition to a dental implant solution? And because this is such an important topic, I put together a free PDF with key questions to guide you if you're facing this exact dilemma. Check out the link in the description to download it. Make sure to watch until the end because I'll share insights that most periodontists won't tell you until it's too late. So let's start with the basics of periodontal disease, or also called gum disease. It's a chronic inflammation of the gums and the surrounding bone around your teeth. Over time, it causes bone loss and tooth mobility. The common treatments you might have heard of include scaling and root planing, or what we also call deep cleanings. You also might have also heard of osseous flap surgery and LANAP laser gum surgery. These aim to reduce periodontal pockets and preserve your natural teeth. But when the disease advances, when pockets become extremely deep, teeth loosen significantly and bone support is severely compromised. That's when we have to consider other surgical options. So what are the two options? As I mentioned earlier, the first option is osseous surgery, which involves cutting the gums, reflecting the gum tissue back, cleaning out the diseased areas, reshaping the bone to reduce pockets, and then suturing the gums back in place. It's great for moderate to severe periodontal disease if there's enough bone for long-term stability. Option number two, which is a newer procedure, is called LANAP, or Laser-Assisted New Attachment Procedure. They use a laser to disinfect pockets, remove inflamed tissue, and help encourage the gum tissue to reattach. It's often less invasive with a quicker recovery than traditional surgery. Both procedures can be highly effective if you're diligent with your home care, get regular professional cleanings, and manage systemic risk factors like smoking or uncontrolled diabetes. Now let's talk about a completely different option. This might sound extreme, but it can sometimes be the best choice. Removing all your remaining teeth and placing 4 or more implants per jaw, often called all-on-4 or all-on-X, then attaching a full arch prosthesis. That means you bypass many existing periodontal issues because once you remove your teeth, the bacteria that live on the tooth roots are essentially gone. Sounds extreme, right? So why choose all-on-4? If your bone support is so compromised that saving teeth doesn't have a predictable long-term outcome, all-on-4 can be a more definitive long-term solution. And if your teeth are extremely mobile, you've had multiple surgeries already, or your finances and time constraints point towards a clean slate, this might be better than pouring more money into teeth that aren't salvageable. Also, it yields better aesthetics, especially if you've lost significant gum or bone tissue. By placing implants in healthier bone and attaching a full arch of new teeth, you can restore your smile's appearance and function in a single streamlined process. Here are the main factors to consider. Number 1, severity of bone loss. If your bone is too far gone, your teeth may not be stable in the long run. Compare the cost and success rates of repeated gum surgery procedures versus implants placed in healthier bone. Number 2, your patient goals and lifestyle. If you don't want frequent gum treatments and multiple surgeries, all-on-4 might be your best bet. But if you're committed to continuous dental care every 3 months and want to keep your natural teeth at all costs, you might choose osseous surgery or LANAP. Number 3, financial and emotional investment. Repeated periodontal surgeries can get expensive with no guarantee of long-term success. All-on-4 is a bigger upfront procedure, surgically and financially. But when done properly, many patients see it as a one-time, more definitive investment. Key term being done properly. This is why I've made so many videos on this topic. Please make sure to check out our channel and all the videos I made about this topic, because when improperly done, all-on-4 can be a disaster. And number 4, systemic health. Factors like smoking or uncontrolled diabetes or autoimmune issues can affect outcomes for both natural teeth and implants. So talk to your specialist about how these conditions might change your prognosis. Everyone's situation is different. There's no one-size-fits-all. But these examples show that both routes, saving teeth or going for implants, can be valid depending on your specific circumstances. If you're unsure of what route to take, get a comprehensive evaluation. Make sure you get a 3D imaging CT scan, a full periodontal exam, and a detailed review of your medical health history. Ask these very important questions. How long can my teeth realistically last with osseous surgery or LANAP? What are the total costs and time investment? Will I be satisfied with how my smile looks and function if I keep these compromised teeth? And consult specialists. A periodontist can address gum and bone concerns, and a prosthodontist can advise on the restorative design if implants are involved. Now let's talk about something most periodontists won't tell you until it's too late. If you're pursuing osseous surgery or LANAP to save your teeth, you might still lose a tooth or several down the road. Each lost tooth can mean an implant, which costs several $1,000s, including the abutment and crown. Over 5 years, you could be facing tens of thousands of dollars spent on periodontal surgery, plus extractions, bone grafts, and implants. Honestly, you'll feel like you're kind of chasing your tail because it seems like the dental work never ends. Also, if any of your front teeth need replacing, it gets complicated. Severe periodontal disease often causes interproximal bone loss, the bone between your teeth. That missing bone is impossible to graft back, which can seriously affect gum aesthetics for a front tooth implant. And if you have a high smile line, you might end up with a less than ideal cosmetic outcome because there's no support for the papilla, the little triangle of gum between your teeth. This is crucial to understand before you commit to saving teeth that may have a poor long-term aesthetic prognosis. Here's the bottom line. There's a tipping point where trying to treat severe periodontal disease isn't worth the ongoing risk, cost, and discomfort, but that point is different for each person. If you're not sure which path is best, consider a comprehensive consultation to review your entire mouth, your health history, and your personal goals. Thanks for watching. If you found this video helpful, please like and subscribe and share it with anyone grappling with severe gum disease or tough dental decisions. I'm Dr. Daniel Choi from North Texas Dental Surgery. Please take care of your smile and I'll take care of you. Thanks.